Good morning, everybody. My name is Dr. Rupinder Singh Dhall. I am professor in PG Guided Department of Prosthodontic, Himachal Institute of Dental Science, Paonta Sahib, Himachal Pradesh, India. And I'll be presenting a case series on ocular prosthesis. And this is the background of my presentation. There are various methods of replacing enucleated or eviscerated orbital content with either customized ocular prosthesis or selecting a stock eye shell, reline it after impression making, and fabricate ocular prosthesis. So we'll be showing three case series in this scientific presentation. First, enucleation. Enucleation is the removal of the intact eye, leaving the muscles and other tissues attachment within the orbit. The advantage of enucleation procedure is that the socket heals much quicker and without pain. Evisceration is one of the second procedures, the removal of the content of the eye, leaving only the scleral shell. Following evisceration, there is more post-operative pain and swelling of the conjunctiva. The sclera contracts to a fibrous mass in the floor of the socket with the extraocular muscles attached to it. Therefore, the socket is not so empty and the floor of the socket moves better. An artificial eye, usually the ocular prosthesis, therefore looks more natural after evisceration. Exenteration is the removal of the eye and content of the orbit. The principle is the entire orbital content down to the bone are removed. This is often covered with a skin graft. Exenteration is a mutilation operation and is only indication in the treatment of some malignant tumor in the orbit. Normally, a maxillofacial prosthodontist rehabilitates with orbital prosthesis. These are the case one of the three case series which we'll be presenting. First one is enucleation. This man presented with a enucleation procedure done few years back. We made primary impression by boxing the face area and applying marginally petroleum jelly. A ophthalmic alginate was injected with syringe. The backing was done and finally obtained the cast. The master impression was done, and this is a stock eye with the back surface showing modeling wax, and finally acrylized in pink acrylic wax, acrylized in resin. This is the final outcome you can see. This case was done in 2012 and the patient is still having the eye ocular process given by us. The second case is evisceration case where you can see the contraction of the scleral mass and the attached muscles. We made primary impression by injecting the ophthalmic alginate, which was made cold to increase the working time, and backing with plaster of Paris. After retrieving, you can see the alginate very nicely causing the facial structure and the ophthalmic socket. Indexing was done and finally the master cast was obtained in 2 parts for reorientation. The final impression was done by using polyvinyl siloxane injected into the eye socket with a syringe which was coated with an adhesive. A stock eye was chosen, trimmed and tried to adjust in the master cast prior to doing a wax trial, and the acrylization was done in a crown flask with a clear heat cure acrylic resin. And this is the final outcome. You can see pre and post. And the patient was very happy with the outcome. The third and final case is also evisceration case, but this was a much tougher case as the eye socket was quite filled. And we did primary impression with ophthalmic alginate, made a primary cast, and then finally chose one of the stock eye which closely resembled to the contralateral eye. Back strive was done, and finally the acrylized eye ocular process is given to the patient. And you can see how the central pupil have the same orientation. And this is all the compilation of the three cases you can see, which we did first, second, and third, and the final outcome are more than best. But there is always a future, and this is what is going on right now. We are in a process of developing an artificial eye where the patient can see, and this is called as bionic eye. But still, there is more scope. Thank you for listening. Thank you so much.